friend or a loved one and the changes you have noticed in him recently? Perhaps your teenage daughter seems withdrawn, or maybe your aging father talks about being a burden on everyone. These are all possible signs that a friend or loved one may be suffering from depression and thinking about suicide. About 80% of the time, people who kill themselves have given definite signs that they are suicidal or have talked about suicide. The key to prevention is knowing what the warning signs are and what to do to help.
Hello, I'm Dr. Alan Berman, Executive Director of the American Association of Suicidology. Suicide prevention is very important because we have evidence that lives can be saved, that pain can be relieved, and that people at risk for suicide can lead long and productive lives. Many suicides are preventable, especially if we join with professionals as gatekeepers or first finders and help people at risk get into treatment as needed. If we are informed about the warning signs of a depressed or suicidal person and the ways that we can help, stigma can be reduced, policies and procedures that now may present barriers to getting help can be changed.
This video will cover the following information: understanding depression and its connection to suicide, recognizing the signs that a friend or loved one is suicidal, the groups at risk for suicide, how to help a person who you think may be suicidal. Depression can be defined as an emotional state in which people have extreme feelings of sadness, dejection, lack of worth, and emptiness. Depression is not the blues. The blues are normal feelings that eventually pass. The feelings associated with depression last longer than a few weeks. No matter how hard depressed people try to feel better, they can't shake their depression.
Depression can be characterized by 5 or more of the following symptoms or warning signs: a depressed mood or markedly diminished interest or pleasure in activities for most of the day, significant